Dialectical behaviour therapy is a behavioural therapy that was developed by a woman called Marsha Linehan in the US, and essentially it was designed for people with a diagnosis of borderline personality disorder, and specifically actually women who self-harm. However, it's now been broadened and it's a therapy that can help a wider range of difficulties, but typically the evidence base is around people who find it difficult to manage their emotions. So people learn all sorts of different ways throughout their life of coping with emotions, but some of these coping strategies can be very unhelpful or potentially quite self-destructive. So examples of these sorts of behaviours would be things like excessive drinking, self-harm, suicidal ideation or suicide attempts, aggressive attacking behaviours that cause problems within relationships. And DBT would focus very much on targeting those particular behaviours and on helping people learn new and more helpful ways of managing their emotions. So DBT is a long-term therapy. The first stage is what we call pre-treatment. This typically involves about 6 to 8 sessions, and it's just to make sure that somebody is really ready for DBT. So after pre-treatment, somebody would actually engage in full DBT. This involves individual weekly sessions and attending a weekly skills group. The skills group is about learning new skills to help people manage emotions, and we run different modules. So we run modules in mindfulness, emotion regulation, distress tolerance, and relationship effectiveness. Mindfulness is all about becoming more aware, more self-aware and aware of what you're experiencing, and also learning to be more present. Emotion regulation is about learning to understand your emotions a little bit more. So being able to identify and name what emotions you're feeling and finding ways of reducing emotional vulnerability. Distress tolerance are skills that we learn to help us manage crises and get through very difficult situations in our life. And relationship effectiveness is focused on assertiveness, being able to say no, being able to make requests, and learning skills that help us to have really healthy, effective relationships. As with all the therapeutic approaches that we offer here, this would be considered in the assessment session. If somebody came to that appointment and they'd been given a diagnosis of borderline personality disorder, which is also called emotionally unstable personality disorder, then we would definitely be considering DBT. But some people might come without a diagnosis, so if they find that they maybe have traits of that diagnosis, which again we could explore more in the assessment, or they're engaging in very self-destructive, unhelpful coping strategies, coping behaviours, then it would definitely be worth considering DBT. But as with all the therapeutic approaches, this would need a thorough assessment before we decide on what approach to take.